Hi, dear gentlemen and ladies, welcome to my presentation. My presentation entitled Knowledge and Application of Constraint-Induced Movement Therapy in Stroke Rehabilitation among Physiotherapists and Occupational Therapists. Stroke. A stroke occurs when a blood vessel that carries oxygen and nitrates to the brain is either blocked by a clot or bursts or ruptures. When that happens, part of the brain cannot get the blood and oxygen it needs. So it and its brain cells die. Approximately 80% of stroke survivors have motor impairment of the upper extremity that gravely affect their ability to perform activity of daily living as well as social participation. Many advanced rehabilitation approaches to treat patients after a stroke. One of the rehabilitation techniques used for improving the impairment in motor function is constraint-induced movement therapy. Constraint-induced movement therapy, CIMT, is an effective intervention that has been shown to facilitate upper extremity functional recovery following stroke. Despite strong evidence, the use of CIMT in practice is limited. Moreover, given the lack of studies examining the use of CIMT, empirical knowledge is needed about the therapist's perceptions, the actual application, and perceived barriers to implementation. Therefore, the purpose of my study was to determine the current knowledge and clinical application of CIMT by therapists working in stroke rehabilitation within Selangor, Malaysia. A total of 65 eligible therapists participated, 40 physiotherapists and 25 occupational therapists. The findings of the present study have shown that most therapists have reported use of CIMT. The application of CIMT in clinical practice was stated by 76.9% of therapists, whereas only 3 therapists have no CIMT knowledge. Also, the majority of therapists applied CIMT in subacute and chronic stroke stages. However, reservations that prevent the application of CIMT have been identified as a lack of training, lack of knowledge, and time constraints. The most source of knowledge was in service training, reading papers, and study courses. To date, the study has highlighted barriers and challenges to the implementation of CIMT. The findings from the study show numerous actual implementation that are deserving of future study. Thank you so much for your listening.